We are live, ma'am.
So good evening, doctors. Good evening, everyone. AMOGS and Shield Healthcare are happy to welcome all the participants and guest speakers for today's webinar. I'm Dr. Prachi from Shield Healthcare, and thank you very much for your presence this evening. We have international guest speaker with us, Dr. Marc Delere, who is joining us from France. And Sir is a medical counselor in ingredient nutritional from France. Sir has a diploma in medicine from France, also diploma in clinical gerontology, specialties in micronutrition, orthomolecular medicine, also specialties in nutrition and dietetics, also in nutritional biomarker. Sir has special interest in acupuncture and medical hypnosis. Sir has many publications and contributed to book chapters. And Sir has collaborated as a medical counselor with different labs in France for research and development and clinical trials. So welcome, sir. Thank you very much for accepting our invitation.
Well, thank you, Dr. Prachi.
Yes, sir. Thank you. We have another well-known speaker, Dr. Ajay Mane. Of course, sir needs no introduction. Sir is Vice President-elect of FOXI, Second Joint Secretary AMOGS, member of NIMC, that is National Inspection and Monitoring Committee of Government of India, medical legal consultant for 18 years. Sir is chairperson of official AMOGS website till 2022. Also chairperson of Sexual Medicine Committee from 2014 to 16, and a chairperson of Adolescent Health Education Committee of AMOGS from 14 to 16. Past president of Aurangabad OBGY Society, ex-superintendent MGM Medical College, Aurangabad, trainer of FOXI Adolescent Healthcare, and health advisor, Sports Authority of India, that is of Aurangabad. Charter President, Rotary Club of Aurangabad Elite. So thank you, sir, and a warm welcome from Shield Healthcare. So without further ado, yes, sir. So without further ado, I request and Dr. Marc Delere to deliver his guest lecture on the truth about stress and infertility, role of lactium. Over to you, sir. Thank you very much.
Will you manage slides or?
Sure, sir. I'll share the slides.
Okay.
I'm sharing the screen.
Thank you. So, first of all, I would like to thank Shield Healthcare for their invitation. I'm going to talk about stress and infertility. I'm a medical doctor, nutritionist working in Saint-Nazaire, which is a town in the west part of France, Brittany. I have always been concerned by stress. I think that if you want to practice prevention, which is for me essential, you have to take in charge stress, because stress is leading to many other diseases, metabolic diseases like prediabetes, diabetes, psychiatric diseases like anxiety, depression, cardiovascular diseases, and immune disorders with disease like cancer or infectious diseases. So prevention has always been a very important matter for me. I wrote 2 books on that, and I always check stress with my patient. So first of all, what is stress? Stress is when someone is losing control, when someone do not feel in control of the situation. And that's the case with infertility. When a situation is unpredictable, or when a situation is new also, that leads to stress. And when your ego is in danger, there is also a problem of stress. And here, with infertility, that's the ego is also having a problem, you know, womanhood and femininity and manhood and masculinity are at stake there. So it's difficult for the couple to manage those disorders of infertility. While stress is also balance between challenge and competence, job demand and resources, and there is a disequilibrium when stress is there. So maybe we can go to the next slide. Well, as you know, well, India is having an epidemic of infertility, well, just like some Western countries. But here, it seems that in your country, 25% of a couple in the reproductive age are struggling with infertility. So that's a big burden. So next slide. Well, as we're gonna look more, stress, as you know, is the contributing factor to infertility. Next slide, please.
Yeah, just a moment. Yeah, sorry about that. I'm got stuck. Sorry about it. Is this okay?
Yeah, perfect. Psychological stress, as you know, is a major contributor. We're gonna check that on with scientific literature to both male and female infertility, and that will affect every aspect of fertility: libido, sperm quality, ovulatory capacity, implantation and conception rates. Social stigma will also contribute to a higher stress. And the impact of stress on infertile couples is very important. Some studies are showing that the psychological symptoms associated with infertility are similar to those associated with cancer. So that's a very high level of stress on women, but also on men. So the infertile couple will very often withdraw and isolate themselves from family, friends, and community when they are undergoing all those disorders of infertility. A couple with participating in an IVF program will be highly stressed, especially after a failed IVF cycle, of course. And studies show that when stress is there, that increase the dropout rates from IVF. Next slide. Thank you. Well, the solution is to act on the 3 stress pathways, whatever solution we choose. The hormonal pathway that is impacted by stress, a neuronal pathway, and the metabolic pathway. Next slide. Hormonal pathway is the first one. And there, in that slide, you can see the difference between short-term stress and long-term stress. On the first part, on the left part, short-term stress is linked with epinephrine and will lead to an increased heart rate, increased blood pressure, but also an increase of glycemia, and also a dilation of bronchioles, change in blood patterns too, in flow patterns, sorry, and an increased metabolic rate. The long-term stress response will have an impact on the retention of sodium, an increased blood volume and blood pressure, and an increase also of immune disorders. Next slide, please. Last slide, you can have a look on all the different organs, different parts of the of our organism which are concerned by stress. And you can see that the digestive system, the pulmonary system, the cardiovascular system, eyes, skin, and the liver are all concerned by the stress answer, with, of course, leading to fertility issues, and we'll see later on also sleep issues. Next slide, please. Here you can see that stress is disrupting the hormonal pathway by increasing the CRH and the ACTH, leading to an increase of epinephrine and cortisol. Next slide, please.
Yeah. I am sorry, something is... I'm sorry, my slides are getting stuck. I'm so sorry. I'll just open again.
Here is the first sympathomedullary pathway leading to the secretion of epinephrine, which allow our organism to be ready for the fight or flight answer, for the fight or getaway answer, the immediate answer to threat. Next slide, please. The other well-known axis is the hypothalamic pituitary adrenal axis, leading to the secretion of cortisol, which appears quickly after epinephrine, and which lasts if the stress the threat is still going on. Next slide. Here is the optimal diurnal cortisol rhythm, and as you know, while the secretion of cortisol is at its peak is higher early in the morning and lower in the evening. But when stress is there is a disrupt of it disrupts that diurnal cortisol rhythm. Next slide. Thank you. Here you see that stress is through cortisol acting on the GnRH and the balance of LH-FSH, leading to ovulation disruption and also spermatogenesis disruption. Next slide. Here we see that psychosocial stress is acting on the pulsatile secretion of GnRH. You see that the pulse amplitude is decreased, and the answer to GnRH is also decreased. Next slide. There is also an impact of stress on human endometrium through the disruption of the HPA axis and through the disruption of the HPG axis, leading to the inhibition of the epithelial and stromal cell proliferation, the stromal cell differentiation, inhibition of both, and an impaired endometrial receptivity, and also it affects the embryo implantation and development. Next slide. So after that hormonal pathway, the second pathway will be the neuronal pathway. And here, which is at stake is glutamate neurotransmitters, excitatory neurotransmitter, and GABA, inhibitory neurotransmitter. When you've got stress, there is an increase of the glutamate activity and a decrease of the GABA activity, which usually in normal condition will relax the brain function and the physical activity. Next slide. That problem leads to an impaired spermatogenesis and impaired oogenesis. So the hypothalamic pituitary adrenal axis and the hypothalamic pituitary gonadal axis are regulated by GABAergic signaling. So if there is a disorder, there will be some, of course, problems. In stress, inhibition decrease of GABA is causing an increase of CRH. And stress, we've seen that, alters the activity of GnRH neurons, and by that cause disrupts reproductive events. After those two pathways, the third one is the metabolic pathway. Next slide. With a ratio which is very important, the cortisol DHEA ratio. When that ratio is high, the stress is high also, leading to side effects, very important side effects. Here you see that when stress is there, of course, on the left part of the slide, you see that from cholesterol, you will have the production of cortisol. But that will, there is a shunt, in fact, going only with cortisol, and a decrease through stress of the DHEA formulation. So the DHEA is linked with testosterone and estrogen. If you have less DHEA, well, you will have also less, of course, testosterone and estrogen, leading to, again, reproductive disorders. So that ratio is very often used in clinical trials or about stress also. Next slide. So we are going to have a look now on the scientific literature about stress and infertility. On that slide, that article insists on the fact that anxiety and depressive symptoms are common among women with unexplained infertility. And they conclude that strategies should be developed to better support to treat this high-risk population. Next slide, thank you. In this article, they note that 22% of infertile patients experience stress mainly associated with the duration of their infertility. If the infertility is now going on for months, well, the stress will be really chronic and higher. In this article, they underline the fact that life stress measured both objectively and subjectively are associated with sperm concentration, motility, and morphology. And they used for that the perceived stress scale, which is a tool to analyze stress. Next slide. In this article, they assert that one of the common causes of anovulation is the stress-induced anovulation, or they call functional. And you can see that the percentage is very high, 34%. Next slide. In that article, they underline the fact that anxiety is associated with both pregnancy rate and live birth rate in IVF patients. An effect that is, of course, partly mediated by the HPA axis. On the left, you can see that the norepinephrine levels are higher for the non-pregnant woman. And on the right, it is a cortisol level, which is higher for the non-pregnant woman than that for the pregnant woman. Next slide. In that article, they note that rates of stress, anxiety, and depression among IVF patients are higher than in a general population. If the level of infertility-related stress is higher, while the IVF success rate is lower. Findings in the study indicate the need, the authors are saying, for the specific psychological intervention for all infertility women to improve the IVF success rate. Remember, I told you that the level of the psychological symptoms associated with infertility are similar to those associated with cancer. So it's a very high stress. In that article, they insist on the fact that person having abnormal hospital anxiety and depression score have a lower level of testosterone, and that it's for male, of course, and that the sperm count, the motility, and the morphologically spermatozoa, normal spermatozoa, are lower with person undergoing hospital anxiety and depression. So, reduction of stress before fertility treatment is very important. Many things can be used. Meta-analysis showing that psychotherapy accompanying IVF is effective. So you need to support your patients undergoing IVF, having infertility disorders, to get help from professionals to deal with their stress. And doing that, the result will be much better later on. So stress management is something which is very, very important in my own clinic. But also, can we come back to the previous one? Yeah, thank you. Just to not to forget when you manage stress, that three very important things on that slide. The exercise. Exercise is very, very important. Number 10,000 steps a day is a recommendation. It is important to reduce the level of stress. A good nutrition also, with polyunsaturated fatty acids, with vitamins, with trace elements, with fruits and vegetables, with the right amount of protein, will be helping for the management of stress. And also the sleep. Sleep is very, very important. 7 hours a night is necessary to reduce, to manage stress, and without forgetting all the techniques of relaxation, such as meditation or self-hypnosis, which are helping also a lot to manage stress. Next slide. So some supplements also can be useful to treat, to help control the level of stress. Supplements that are able, for example, to reduce cortisol and epinephrine. Next slide. So one of them is lactium. Lactium is also known as alpha-casozepine. It is a decapeptide. It is present in milk protein hydrolysate. It has anxiolytic properties. It acts on the GABA-A receptor, and it has a structure similar to benzodiazepine, which acts on the same receptor, but we're going to talk a little bit later on that. That's the company Ingredient Nutritional that has developed that alpha-casozepine at an industrial level, and a lot of data now are here, toxicology data, animal data, clinical data, because that product is now used worldwide for more than 20 years. Next slide. Alpha-casozepine is is a decapeptide which binds to the alpha-2. It's not omega, it's alpha-2 GABA-A receptor. Sorry for the mistake on that slide, which improves GABA activity. It's not binding to the alpha-1 GABA receptor like benzodiazepine, which due to that is not causing any sedation. You won't have sedation with lactium. Next slide. So lactium is alpha-casozepine is able to relieve stress and anxiety. You can see here the difference at the left between with the state E, it's a state trait anxiety inventory. On the left is a questionnaire which is acting, thank you, on which is used when you are making clinical trials on stress. And you can see that on the final visit, 6 weeks later of taking lactium, well, you have a real difference between placebo and lactium with stress. And you have also, which is very important, we'll see that also, an improve of the sleep quality. And here with Pittsburgh Sleep Quality Index, you can see that on D14, day 14, day 28, and day 35, the effect of lactium compared to placebo is significantly higher. Next slide. A slide just to look at how the alpha-casozepine is produced in the stomach gut of the baby. It is through the enzymatic system, which is mainly trypsin, that is able to transform casein, get alpha-casozepine through the transformation of casein. Next slide.
Yeah, I'm just getting stuck when there is when I do it full view, that is getting stuck. I'm so sorry.
No, no problem. And on that second slide, you can see why alpha-casozepine is not formed in adults. It's because the digestive enzymatic system has changed. There is no more trypsin, but there is pepsin, and pepsin is not able to transform casein to get alpha-casozepine. Next slide. So now we are having a look on some of the clinical studies, or some of the studies that have been done, clinical trials with Lactium. Well, here they were evaluating the anti-stress effect of Lactium on plasma cortisol with patient volunteers facing stress situations. Next slide. The stress was induced by Stroop test, and which is a psychological method, and cold pressure test, which is a physical method, and we were, of course, measuring plasma cortisol. And you see that the Lactium prevents the increase in the plasma cortisol level 3 hours later after those stressful events. Next slide. Here, that study was made with 1 gram and 200 milligrams for 2 days of Lactium. And they were again looking at the plasma cortisol level after stress test, and you can see that compared to the placebo, well, Lactium is efficient by reducing the level of cortisol. The same in the same study, they were also looking at the hemodynamic parameters, and you can see on the left the systolic blood pressure, which is reduced. The systolic blood pressure linked with stress is reduced when you're taking Lactium. And on the right, the diastolic blood pressure linked with stress is also reduced when you're having Lactium. Next slide. In that study, study Biofortis, they were looking at the physiological effect of 300 milligram of Lactium, which is the good pathology for our clinics, that the one which gives you the best result. It's possible to go higher, but 300 milligram is good. And in that study, they were using the STIs, the state rate anxiety inventory. Next slide. And you can see in that slide the difference, the significantly reduced perceived stress with Lactium compared to the placebo at first 3 weeks and then 6 weeks of taking orally Lactium. Next slide. In that study, they were using Lactium to on chronically stressed women to have a look on different parameters like physical stress, physiological stress, psychological stress, even social life, the social interaction, all were analyzed and compared to a placebo. And in all those compartments, Lactium was decreasing all the side effects of stress and really improving the quality of life of those women. That posology of 150 milligram at that time, it was for during 30 days. Next slide. Another study of Lactium 300 milligram per day for 1 month, and evaluating the effect of the cortisol awakening answer. And you can see, which is a marker for chronic stress, a difference again between placebo and Lactium after treatment of Lactium during 1 month in 100 volunteers. Chapter now on sleep and fertility. Sleep is a very important gate of stress. If the sleep is not good, or stress is growing, and stress vice versa is decreasing the quality of sleep. So there is a whole problem, a loop which is really bad. And as you can see, it is well known that sleep disruption is impacting the fertility of women. Your first study I've looked at was sleep disturbance and fertility in women, sleep and reproductive health for the second, for the third, in the harm of Morpheus, meta-analysis of sleep and fertility, and for the last one, human fertility and sleep disturbances. So it's very important to improve sleep through the improvement of stress also. Next slide. In that study, which was double-blind, randomized, placebo-controlled, they were analyzing and using the Cohen-Pittsburgh sleep quality and the insomnia severity index to analyze the result of Lactium on sleep disorders. Next slide. I choose only that study. There were some other studies on sleep with Lactium too, but that one is showing here that the total sleep time is improved after 1 month of Lactium 3000 milligram per day. You can see the difference between placebo and Lactium on the right. Next slide. In the slide, they analyze the sleep efficiency through the sleep agenda and the actigraphy. The sleep efficiency is a ratio between the total time spent asleep compared to the total amount of time spent in the bed. And the normal sleep efficiency is 85%. So here you can see with the subjective parameter of the sleep agenda that after 1 month, well, Lactium is really doing much better than the placebo. And on the objective parameter of actigraphy, again, on after 1 month of prescription of Lactium, there is a difference between the placebo and the Lactium. Next slide. The sleep latency now is the length of time that you need from lying down for the night until the sleep onset. And the sleep latency is again improved by Lactium compared to placebo. With the sleep agenda, the subjective, you can see that there is a real improvement with Lactium. And with the actigraphy, the objective, you have also a difference. Next slide. And with that slide, the WASO, the wake up time after sleep onset. The WASO is the total number of minutes that a person is awake after having initially fallen asleep. For example, if one wakes up during night and is awakened for 25 minutes before going back to sleep, the WASO will be of 25 minutes. So with Lactium, the WASO is also really improved. You can see the difference between the Lactium and the placebo, both with the sleep agenda and with actigraphy. Next slide. So we can, with those studies, conclude that Lactium leads to an improvement of the overall sleep quality. That sleep is improving its time, is quicker to get asleep, and decrease the night awakening also. And as I told you before, sleep is very important to manage stress. So it's really a gate for stress. And to manage sleep is a very important concern for me and for a person who wants to take in charge stress. Next slide. So to end, that's the last slide. Well, we knew that infertility was linked with stress, was causing stress, and that stress was also worsening infertility. Well, we know now that also many psychological techniques can be used to help our patients for that. Well, I'm not a gynecologist, so I have not the experience that you have, but still I have experience with stress because that's something which counts a lot for me. And well, to help our patients through different psychological techniques is important, and to help them through medicines also to get away with stress, to improve all the side effects of stress is also very important. Alongside with, we've seen that the exercise, the diet which is can improve the low-grade inflammation linked with stress, which can improve also the oxidative stress linked with stress. All that allowing our patient to live a better life and to get a better health, and when we are concerned with infertility, to improve the disorders linked with infertility. Well, thank you for next slide. Thank you very much for listening, and I've been glad to share with you my experience.
Thank you, sir. Thank you very much. It was an excellent presentation, and I am sorry for that technical glitches. The slides were getting stuck, so sorry about that.
No, thank you very much for your help, Dr. Prashi. Thank you very much.
So one quick question before I typed a few more. So would you recommend Lactium for both men and women who are coming for infertility treatment?
Yes, of course. As soon as the stress is present, well, men and women are concerned with that. I don't know, in my opinion, women would be a little bit more stressed with infertility disorders, but I don't have the experience of my colleagues who are listening, so I prefer not to say anything which is not true. Well, anyway, you can treat. For me, women are very, very important, but men also. We've seen the impact of stress on the semen, on the spermatogenesis. So yes, it will be good to treat also men alongside women.
Yes. So next question, I have typed it to you. Any side effects are there in the chat box?
The big difference between we've seen that Lactium has a structure similar to benzodiazepine, but it's acting on the same GABA-A receptor, but it's not acting exactly on the same. It is only the alpha-1, the alpha-2. The benzodiazepines are acting on the alpha-1, and that's why. With the fact that Lactium is acting selectively, you do not have any sedation. You just have anxiolytic effect of Lactium. There is no much side effects of Lactium. It has been prescribed worldwide for now more than 20 years. And it's very, very well tolerated. There is no dependence. You can stop it quickly, not like benzodiazepines, and it's very, very well tolerated.
Right, sir. So these were the two questions which we received. So thank you very much. Thank you for giving us time and your guidance. And we were really honored to have you with you, sir. So thank you very much. Thank you again.
Thank you. Thank you very much. Yes.
Can I ask one question, sir?
Yes, sir. Yes, please.
The drug dependency means the habituality. What is your experience about that Lactium? If we start the Lactium to the patient gets habitual to it.
Dependent.
Like that.
Yeah. So when you start Lactium, well, Lactium has got two possibilities. You can use it through acute stress, but acute stress is not for performance, for stressful events. And very often you use a higher amount of a higher dosage. For chronic stress, 300 milligram is perfect. 300 milligram a day is perfect. But you will have to prescribe it at least 1 month, between 15 days to 1 month. 1 month is better. Sometimes you can go more than that. It happens for me to treat patients with Lactium for more than 3 months. It sometimes, but 3 months is normally the most for me. Sometimes it can happen that I prescribe for a longer time, but for example, for businessmen that cannot change anything of their table time or planning, which they should, but they can't. So I help them a little bit more longer, even if they should change. But when a patient stops Lactium, everything is perfect. There is no they are okay. If they know more stress, if the stress is still going on, it's going to be a problem. But if the stress is, if they've changed something in their life, well, Lactium has helped them to change something, to feel better. So if everything is okay, they will quit Lactium very easily. But they will not, unlike benzodiazepine, which are sometimes very difficult to quit, they will quit it very, very easily. Sometimes I use it to also stop benzodiazepine. I use Lactium to make between the stop of the I stop benzodiazepine, I give Lactium, and then I stop Lactium. But Lactium has no side effect, is efficient, but is not as strong as the benzodiazepine.
Okay.
It's efficient, but it's not as strong as benzodiazepine. That's also another reason why it's easier to quit it.
Yeah. Thank you, sir. Thank you very much.
So, thank you.
Thank you, Dr. Delere. Thank you very much. It was an amazing presentation, and thank you for your guidance, your time, and we are honored to have you with us. Thank you again.
Yeah. Well, thank you, everybody, and I've been really pleased to, and I'm glad to listen now to my colleague.
Yes, sir. We will quickly move to our second topic. We have our speaker, Dr. Ajay Mane sir, with us. Again, we are very honored to have him back. Sir's topic is Assisted Reproductive Technology, the Regulation Act 2021, Benefits and Limitations. So over to you, sir. Thank you very much. We can see your slides, sir. Sir, you're on mute.
Yeah. Now, can you hear me?
Yes, sir. Yes, sir. Yes, sir. We can hear you.
Yes. Thank you. Thank you very much. At the outset, I must convey my gratitude to Shield Healthcare, Dr. Stalin, Dr. Prachi, and Nishant. And I'm very delighted to be a part of a webinar where Dr. Mark sir is speaking. And thank you for giving me the chance. Thank you very much. Today, I'll be speaking on the Assisted Reproductive Technology Regulation Act 2021, implemented in January 2022 and gazetted into March 2022. Okay, it's limited to India. Basically, before there were no acts related with the ART and surrogacy. So we have newly formed it. How much time do I have, Prachi?
Sir, it is up to you, sir. We haven't kept any time limit. Yes.
Right. 15 to 20 minutes will be sufficient for me. Okay. What is the history of ART basically in India? Convoluted and long trust with assisted reproductive technology began in 1978 with the birth of India's first test tube baby in Kolkata. One unauthorized test tube baby was done before that 3 years back, but not recorded. But this is recorded officially in 78. Today, approximately, there are over 40,000 ART clinics in the country. It's a bit more now there. And 2005, Indian Council of Medical, ICMR, has given one guideline pro forma, which was converted into the TACT. And here is one additional knowledge from my side. In September 1995, formed a march that is medically aware and responsible citizen of Hyderabad, the group of people, and took initiative and brought it into notice of the NABL that unethical practices are taking place. So it started at government level, and 20th April 2001, ICMR formed a committee to regulate such ART practices in India. So sorry. In 2004, national guidelines for accreditation supervision and regulations came into existence by ICMR and central government. In 2008, ART formulated and amended in 2010, 14, 17, and now in 2021 and gazetted and published on 25th of January 2022. Regulations came in March 2022 and now it is implemented. Introduced in Lok Sabha, this is the detail. I am not going to detail. Need of this act. Why the act is needed in India? Basically, ART clinics and assisted reproductive technology banks were there. There were few were uncontrolled. Most of them are honest people, but few were uncontrolled. For prevention of misuse, safe and ethical practice of ART services, those who are doing ethical practice, to prevent them from other consequences, that the law is needed. And ART research and development, that is the basic aim of every activity in the field of academics. So it is formed and now it is final, included 46 clauses and 6 chapters. These are the chapters. I'm not going to read basically. The definitions are very important. Preliminary, the chapter 1, basically assisted reproductive technology with its grammatical variations and cognitive expressions. Why? Because we are multilingual states. In India, we speak many languages. So meaning of a word can be different at different regions. So they have given these grammatical variations and cognitive expressions. Means all technique that attempt to obtain a pregnancy by handling the sperm or the oocyte outside the human body. That's why the IUI procedure came under this law, or else before the ICMR guidelines, the IUI was not under this law, but now it has come as it is handling of sperms out of the human body. All right. Then assisted reproductive technology bank means an organization which shall be responsible for the collection of gametes, both storage of gametes, both embryos also, and supply of gametes to the assisted reproductive technology clinics or their patients. Okay. This is confusing as our old banks were not collecting and storing ovoms, because in olden days they were collecting only sperms and sperm banks were there. Now it is called as assisted reproductive technology bank. Why? They are collecting both male as well as female gametes and embryos, storing and giving. Likewise, it is somehow it is a broaden the base. So sorry. ART clinic, it is to be registered with the National Medical Commission. Commissioning couple means an infertile married couple who has married before 1 year with unprotected sexual activity and do not have a pregnancy. That is a infertile couple. That is the definition in India. 1 complete year of efforts without any contraception, but naturally not conceived, and that is to be married couple. If it is in live-in relations, they are not allowed for this ART and surrogacy. What do you mean by embryo? It is 0 to 56 days. Fetus and everything is covered under this. Then chapter 2 gives the authorities to regulate the assisted reproductive technology. There are 3 bodies basically: National Assisted Reproductive Technology and Surrogacy Board, then the State Surrogacy Board, and the local level. And the National Assisted Reproductive Technology and Surrogacy Registry also is there, where we send all the information, and there they keep this. We need to keep the record for 10 years. And after 10 years, we need to submit it to the National Registry. And by chance, if we close our clinic, or we shift our clinic, or we somehow get rid of that clinic, so we need to submit every data to the National Registry, because it is a confidential data. That's why this National Registry is important. These are the basically duties of the National Registry and everything: to advise the central government in policy matters, implement the act, rules and regulations, to lay down the code of conduct of persons working in these clinics and banks. So the qualification and the working pattern and the setup, everything is to be decided by these central, national and state, and to be decided by national and to be implemented by the state and local authorities, and supervise the bodies, registry and authorities. Okay. The state board shall have the responsibility to follow the policies and plans laid by the national board, to implement the act at the state level and the local level. So it is the same. Then procedure of registration. What is the procedure of registration? We need to give one complete. There are two types basically. Many clinics are running before uh, that formation of this law. So they are already considered, but they need to fill the form on the registry format, and the new one they need to again fill the form with the new one. In old that rules, they have given the fees as 5 lakhs for level 2 and 1 lakh for level 1, but now they have reduced to level 1, that is IUI is advised, and the done, then it is 50,000. Then level 2, where ART techniques are used, all in vitro fertilization, everything, the fees is 2 lakh rupees, and the renewal is same, 50,000 rupees for level 1 and 2 lakh rupees for level 2. And the bank, they are charge registration fees as a 50,000, renewal again 50,000. That is the complete setup. Now they have started giving the registrations. At many places they have given the registrations, because within 6 months it was to be given, so they have started. Registration is valid for 5 years. After 5 years you need to renew that. Registration should be displayed. It is form B. A is application, B is the registration. It should be displayed in the waiting area of your hospital. Basically, state authority decisions will appeal to state government if any grievance is there, and central authority to central government. ART clinic will procure gametes from registered bank only, not from unauthorized places, or not from any unauthorized persons or the agents. If it is done, it is a breach of law, and the punishment is very strict, 5 lakh to 10 lakh and 5 years to 10 years imprisonment. It is very stringent punishment. Donor should be screened for diseases. Which diseases? HIV, hepatitis B, hepatitis C, then syphilis, chlamydia are the major diseases for which the donor, oocyte and the semen, both they are to be examined. Okay, then confidentiality of the donor and commission couple must be observed. National registry, medical emergency with consent of the commission couple, and compound court. These are the only 3. Grievance cell must be formed by the hospitals. The ART services, what is the age limit? Woman must be a commission couple. That is the age limit of commission couple. Woman aged between 21 to 50 years, and the husband must be between 21 to 55 years. In India, the age of marriage is 21 for male and 18 for female, but the woman must be 21 years at least for this to avail the services of ART. Then what is the donor criteria? Basically, the donor criteria is same like that. The sperm donor is 21 to 55 years, and the oocyte donor must be between 23 to 35 years. Why? Because that is the most fertile and a period where the ovumes are of best quality in the life of a woman or the girl who is donating. Okay, and for commission couple of ART, the commission couple 21 to 55 years male and 21 to 50 years female is the that. Clinic will provide counseling. What is the counseling? In counseling, we must tell all advantages, disadvantages, side effects, cost, risk, right of the child born through ART, right of the patient, and parallel ways for these procedures. And valid consent must be taken from the commissioned couple. What is a valid consent? Consent must be free from fear and force. Voluntarily, they should sign the consent. And what is the specification and beauty of that consent of the donor also and the commission couple? They can withdraw till the gamete is transferred. After gamete is transferred, no withdrawal is possible. Before that, any moment, both can withdraw the consent. Okay. Then no cryopreserve without consent. For cryopreservation also, consent is must. Prohibition of using material obtained during the ART for any other purposes, because it is to be given to only one commission couple, one donor, one commission couple. It is not to be given to two commission couple, or two donors samples are mixed and given to the commission couple is not possible. Only one donor, to only one commission couple. That's all. Insurance for the oocyte donor for 1 year is mandatory. In surrogacy, it is 3 years. Okay, but in ART, the donor must be given insurance of 1 year for all medical facilities because it is altruistic one. It is not commercial. Commercial is banned. Commercial is not allowed. Commercial surrogacy is also not allowed, and commercial ART techniques also are not allowed. So it is altruistic. So no money is given as a remuneration or payment, anything. All the expenses, medical expenses, and everything is to be borne by the commissioned couple for the donor. Okay. Commissioned couple or woman can withdraw consent before that. I told you. Maintain records of donor, commissioned couple of women for 10 years. That is mandatory. And after 10 years, what we should do? We should submit it to the National Registry. Update the records to National Registry after 10 years. Any closure of the clinics, I told you. Inspection of the records by the National Board or the National Registry or the State Board or any other person authorized by the National Board on this behalf can be done during any period. The period has not mentioned. Like in PCP and they have mentioned that every 3 months the approved authority will come to your place and inspect. Here they have not mentioned, but the inspection can take place at any moment, and the approved authorities are same. That is civil surgeon in rural area and the MOH or the superintendent in the district level or the corporation MOH, chief medical officer of the corporation. The clinic shall retrieve oocytes such a manner that it may be specified by the regulations. Not more than 3 oocytes or embryos may be placed in the uterus of a woman during the treatment cycle. Not more than, because quadruple is not possible. 1, 2, or maximum 3 oocytes or embryos can be placed in the uterus. And at a given time, not more than 7 oocytes must be retrieved from that donor. At a given time, 7. But how many times we can retrieve that, it is not specifically mentioned. There are some flaws in the rules also. With the due period, we will come to know that. A woman shall not be treated with the gametes or embryo derived from more than 1 male. I told you. A clinic shall never mix semen. That is also again pre-existing heritable genetic disease screening. The screening is mandatory for all the approved labs, all embryo before implantation, donors and recipient, because the semen donor, they have to have a 6 months of isolation period for the semen sample to be given to the patients. After donation, they have to be put there for 6 months, and afterwards it is given. The national body and the SB will specify the pre-implantation test. The PCP entity rules are applicable here, so they need to have both registrations, ART registration as well as PCP entity registration. The ART clinic must have a separate PCP entity registration, as they must be having sonography machine with them and doing the sonography on the patients. So the fees is 35,000 for new registration and 17,500 for the renewal. It is again for 5 years. Then we can skip some slides. The screening of gamete donor, collection, screening, storage, semen, and provision of oocyte donor shall be done only by the bank registered. I told you. The semen, yeah, it is again same thing. Semen from males 21 to 555 years is the semen donors, and oocyte is 23 to 35 years. Screening for donors for diseases, which I told you recently. A bank shall not supply the sperm or oocyte for a single donor more than 1 commission couple. That is again the same condition. Oocyte, same condition. Donor, same condition. Previously, it was 10 recipients. 1 sperm donor can give to the 10 recipient or 10 positive pregnancies. Likewise, it was there in the previous ICMR rules and regulations, basically. But now it has become single donor and single recipient. An oocyte donor shall donate oocytes only once in her lifetime, and not more than 7 oocytes shall be retrieved from the donor oocyte. Here is one problem, because if we take the semen sample, perform the IUI or ART, and it is failure, then next time you can take another sample. Not that the same sample is taken from the bank, because first it is a failure, then second time it is a more chances of having failure because the sperm sample is not good, or it is having some problem which is not known to us in 30% of that criteria. So we can take another sample. There is no limit for that. All unused oocytes shall be preserved by the bank for use on the same recipient. It is to be cryopreserved or given for research to an organization registered under this act after seeking written consent from the commissioning couple. If the couple has got pregnancy, everything is satisfied, then the cryopreserved oocytes are to be given only for the research purpose. It is not to be handed over to anybody. It is not to be given to the another patient. Only for research purpose we can give. A bank shall obtain all necessary information along with the Aadhaar card for the identification. This is again another flaw we can say. We need to give every detail of the donor to the ART clinic. Means except name and address, we give everything. And in everything, the new form contains a column called as the Aadhaar number. Depending upon that Aadhaar number, the ART clinic persons may know the identity of the donor. That is the problem. But it is considered that the ART people, ART clinic people, they won't disclose this to the patient because patient is not supposed to know all the details, and the child is again not supposed to know all the details of the donor. Bank shall obtain all necessary information along with the Aadhaar card for identification. So it is to be linked with Aadhaar card. So identification is proper. The storage and handling are prescribed. Storage will not be more than 10 years, I told you. After that, they will be allowed to perish or donate for the research, or it is to be destroyed. That's all. Human gametes or embryos on their transfer to any country outside India for research shall be absolutely prohibited. For any aim, not for research, not for transferring, not for anything, it is banned. It is absolutely prohibited to transfer the gamete out of the India. Okay. In India also, the transportation is not allowed for another person. If the patient is carrying or taking the oocyte from one place or taking the embryo or the sperm from one place to another place for his case only, for the treatment part with the due permission from appropriate authority, then and then only it is allowed. Without appropriate authority's permission, they cannot transport the gametes. Okay. The research on human gametes or embryo within India shall be performed in such manner as may be prescribed, means the appropriate authority may give the permission. The child born through the assisted reproductive technology shall be deemed to be a biological child of the commissioning couple, and the said child shall be entitled to all the rights and privileges available to a natural child only from the commissioning couple under any law for the time being in force. Means the property and the every family matters law, they are applicable, and he is considered. Okay. A donor shall relinquish all parental right over the child or children which may be born from his or her gametes. Many instances have happened that the donor came to know that this child belonged to their gamete processing, and they said, okay, this child belongs to me. So that's why this provision is made. Sex selective assisted reproductive technology, including advertisement, is punishable. 5 to 10 years, I told you, and 10 lakh to 25 lakh. First time only fine, second time imprisonment, and or both, and third time removal of your name from the registry. You cannot practice for whole life. Abandon, disown, or exploit, cause to be abandoned, disowned, or the exploited in any form of the child or children born. These are the prohibitions, what we cannot do. And the sell human embryos or gametes cannot be possible in India. Run an agency or a racket or using dalal type persons who are intermediate persons who are working for the money. It is not again allowed through this law for or an organization for selling, purchasing, and trading in human embryos or gametes. Import or help in getting imported in the whatsoever manner the human embryos in human gametes. Exploit the commissioning couple is prohibited again. Transfer human embryo in a male person or in an animal is again a prohibited, and it is punishable act. Sell any human embryo or gamete for the purpose of research is not allowed. Only donation is allowed for the research purposes. Selling is not allowed. Use any intermediate to obtain gamete donors, that is dalal type person, I told you, purchase gametes is prohibited. Contravention of any other provisions, first time 5 to 10 lakhs, subsequent 10 to 20 lakhs fine, both or 3 to 8 year imprisonment, that is a rigorous imprisonment. a complaint made by the national board or the state board or by an officer authorized by it. A metropolitan magistrate, that is JMFC, first class judicial magistrate, can have take the complaint and cognizance and start the process. Then we'll move further. Offense, it is told you. It is also told to you power to make rules and this is an additional to other health related laws. Okay, power. These are the powers of this is last chapter miscellaneous. Here they have given the rules and regulations and powers of the central and state board and national registry authority. Power to state, power to search and seize the records, power to make, power to inspect the record at any given time. Okay, power to make rules and regulations. Only these authorized persons for this state and national body, they can inspect your papers, or the judicial first class magistrate, if they order to see, they can, because it is confidential. In MTP, the confidentiality, previously it was only 1,000 rupees if you breach, but now they have given it a 1 year imprisonment if you breach the confidentiality in MTP. In PCP entity also, you cannot breach the confidentiality. Only appropriate authority, the judicial first class magistrate, can see the papers. Okay. And in ART law also, only appropriate authority and the JMFC can see the papers. This is an additional with other health related issues. It is a very comprehensive law. Some flaws are there. With due period, it can be again amended with period and experience. ART are well regulated. The undue advantages which were taken by some bad people, very few of them, most of them are good people, but that is to be restricted. They are well controlled with this act. Surrogacy, separate law is there. They are separate. They are not intermingled. Then statute bodies are well formed. Then punishment are too stringent, so everybody is behaving in a proper manner. Owner of the clinics and banks are made a default accountable. Basically, the director of the chief of the administrative staff is made accountable for any flaw or any breach of law from that clinic. Okay. Then third gender and LGBTQ are not allowed. Basically, only commissioned couple, that too married couple, are allowed. So unmarried couple and single men are not allowed. Single women are allowed. Widow or divorcee woman, she can avail this facility. Then Juvenile Act prohibits single men adopting female children, and now ART Act is discriminatory towards the men. This is the some problematic laws, the two laws. NART and state board need to give complaint. This law is most welcome, but too many restrictions can hamper the field. Commercialization is not allowed for retrieval storage, any, it is altruistic only. And what are the concerns? Basically, no information about pricing charges. They have not mentioned about the pricing or the donor must get this amount, because it is altruistic. So it is donation, it is not commercial. So prices are not mentioned, but all medical bills, medical expenses on other expense, because the stimulation protocols are there. If something goes wrong with the hyperstimulation and all ICU and hospital charges, they are to be borne by the commission. So it is not mentioned. That has to be amended again. Then the bill allows for a married heterosexual couple and woman above age of marriage to use ARTs and exclude single men, cohabiting heterosexual couples and LGBTQ that I told you. What is next? The bill seems to be violating Article 40 of the Constitution because the Aadhaar card is to be taken, but in law it is mandatory, so we have to take the Aadhaar card and everything. Unlike SRB, there is no prohibition for foreign citizens accessing the ARTs, but not all the Indian citizens. Indian citizens, basic Indian citizens, they are NRIs are allowed, but the persons who are not having Indian citizenship but originally from India, they can avail the facilities in India only. Okay, the foreigners are not allowed. In surrogacy also they are not allowed. The bill restricts egg donation to a married woman with a child at least 3 years old. Even here, egg donation as an altruistic act is possible only once a woman has fulfilled her duties to the patriarchal institution of the marriage. So she must have one child. Less or no protection. This is not ambiguity in disorders, the will requires pre-implantation genetic testing and where the embryo suffers, because some tests are made compulsory if the history is indicating that there are few diseases or the conditions which may arise in the incoming baby. So that tests are indicative, and that is mandatory for doing the test. In the sex is not revealed in all cases, but if the sex linked disorders are there in previous generations, mother, father, everything, then the sex is to be revealed with due permission from appropriate authority, and then the treatment modalities or everything is done. The MTP is not done without permission of appropriate authority if it is needed. In surrogacy law also it is made clear that in surrogate mother, if the MTP is to be done, it is to be done with the permission of that surrogate mother's consent, with consent from the appropriate authority. It is like that. These disorders are not specified and will risks promoting an impermissible program of the eugenics. Okay. Children born from ERT do not have the right to know their parentage. It is again debatable issue. So this is again told imbalance between ERT and SRB, both wheels are multiple bodies. There are 3 bodies for ART and 3 bodies for surrogacy, because the laws are different. In Maharashtra also the surrogate body is not formed yet. So the surrogacy people, they are waiting. In I think Telangana state they have formed, or few states they have formed. So it takes time because as it is a new one. So this is the some few problems. Possible gamete shortage, because they have made that 1:1 ratio, 1 donor and 1 commission couple. So the situation may come after few days or few months rather. They say it is poorly drafted, but few says it is a very goodly drafted. We'll come to the conclusion after implementing all the laws. Then the punishment PCPNDT laws are applicable, and this is basically bailable offense. It is to be PCPNDT and MTP is non-bailable. And way forwards, so we follow the rules and give the good output to the desiring people who are good people, and we are good clinicians. We can give best of our knowledge to the benefit of the patients. So government is also helping us. We should also help the government through our proper behavior, and we are there to help the government as well as the patients. So thank you very much. I convey my gratitude to Shield Healthcare again. Thank you very much.
Thank you, sir. Thank you very much. This was a need of an hour, very much needed presentation. Thank you for lucid way with which you presented. So we are ending our webinar. Thank you, Dr. Delere. Thank you, Dr. Mane. Thank you for your presence, guidance, and thank you for giving us time. We are absolutely honored. So good night and good day to you, Dr. Mark. Thank you. Terry is there. Thank you very much. Thank you. And bye-bye.
Yeah,
good night.
Thank you. Bye. Good night.
Thank you very much.
Good night. Good night, sir.
Good night.
Thank you. Fauci, sir. Good night.
Yes. Thank you very much. Yes. Thank you very much for your very interesting speech. Thank you.
Thank you, sir. Thank you.
Thanks a lot.
Bye-bye, Terry. Bye-bye, Mark.
Yeah. Bye-bye. Yeah. Thanks a lot for this opportunity.
Bye.
We hope we will do more in future.
Yes,
sir.
definitely.
100%. Yes. Thank you. Good night.
Good night. Bye-bye.
Bye-bye.
Bye-bye.